The civil society partners to the IAS work on behalf of key and vulnerable populations to keep the IAS conferences inclusive. The current civil society partners include GATE, the Global Action for Trans Equality, the ASHA Foundation, GMP Plus, the Global Network of People Living with HIV, and ICW, the International Community of Women Living with HIV. So who are the civil society partners?
The IAS Conference Committee is responsible for the strategic planning of all major IAS conferences taking place over a 4-year cycle. On this committee, 3 of 7 seats are reserved for representatives of civil society organizations, and the civil society seats are rotated every 2 conference cycles to ensure equitable participation of community voices. The civil society seats are currently filled by Dr. Gloria Alexander of the ASHA Foundation, Erica Castellanos of GATE, and Jessica Whitbread of GNP Plus and ICW.
The role of the civil society partners is to strategize together alongside the IAS to ensure that civil society issues shared by our advocates are front and center of each conference. This includes ensuring that locations meet a set of criteria, including upholding human rights and safeguarding the independence of the conference from outside interference. We also select speakers, advocate for resources for scholarships, and push for stronger and more transparent systems within the IAS conference structures.
To strengthen community perspectives, the IAS hosts 3 conferences. The IAS Conference, the world's most influential meetings on HIV research and its application. The AIDS Conference, the premier global platform to advance the HIV response. The HIV Research for Prevention Conference, the only global scientific conference focused exclusively on the challenging and fast-growing field of HIV prevention research. As civil society, we have historically focused on the International AIDS Conference and had a seat at the conference coordinating committee. Since the conference committee was formed in 2021, civil society now has a say in shaping the 3 conferences, where we can advocate for greater and more meaningful engagement of our community. So what is the criteria for selecting a host city?
Picking a city to host a conference is not an easy task. No city or country is perfect, and all will pose challenges. Our job is to try to mitigate the challenges and push for access. A set of criteria must be met before we can select a host city. These criteria include safeguarding the rights of delegates, especially the most marginalized, by ensuring equal treatment and a safe environment for key and vulnerable populations, including people living with HIV, sex workers, people who use drugs, men who have sex with men, and transgender people. Advancing the local and the global response, such as locations that galvanize the local response and/or provide valuable lessons to the global response. Meeting your health needs by ensuring high health and safety protocols for all delegates, staff, and speakers, including accessible healthcare for all.
Meeting your infrastructure and access needs, including venues, accommodation, and travel infrastructure that can support large gatherings over several days. Technological infrastructure with uninterrupted power supply and digital access, and assurances and details on steps to ensure country entry for delegates. Remaining independent from outside pressure, as host government must support and promote the independence of conferences, and ensuring the long-term viability of the conference, considering financial viability by balancing costs while reserving substantial funding for scholarships and program participants.
In 2023, the IAS introduced a new rotation policy for all of its conferences. Historically, conference bids were open to any city, making it difficult for countries with less resources or infrastructure to compete with high-income countries. However, after years of advocacy, the IAS has launched a new rotational policy for IAS conferences, which creates more transparency about where conferences will go next.
All conferences will travel equitably between 5 defined regions, and conferences will not be hosted consecutively in any single region. These 5 regions are Asia Pacific, Africa, Europe, Latin America and the Caribbean, and Canada and the United States.
The IAS will only accept bids from the selected regions to host each conference, which allows civil society participation in supporting governments to make a bid and ensuring ongoing civil society participation in the bidding process. Countries successful in their bid to host a conference will be notified at least 3 years in advance to ensure a thorough and transparent site selection process, with bids from low and middle income countries strongly encouraged.
So, where do you want the conference to be hosted next?
We know that the 2024 AIDS Conference is happening in Europe, and the 2026 AIDS Conference will be hosted in the LAC region. Where it goes in 2028 and 2030 will depend on our collective voices.
We are so excited to be able to share this news with civil society on the IAS conference's selection process. Together, we need your support to help us monitor and support this new process. This community win would not have been possible without the advocacy of civil society across the globe. So thank you.